Welcome to the Quick Trip from the Psychedelic Support Network, where we hear expert answers to questions about psychedelic medicine and mental health. Dr. Manoj Doss is the founder and medical director of the Institute for Integrative Therapies, or IIT, the first psychedelic medicine clinic in Minnesota. IIT applies a biopsycho-spiritual approach to care in order to produce small, incremental changes in how patients think, react, and behave, which ultimately leads to living a more purposeful and content life. Dr. Doss is a board-certified physician whose passion in psychedelic medicine stems from a recognition that many of his patients were suffering from depression, anxiety, and trauma, but were not realizing significant benefits from current treatment options. As this field grows, he wants the IIT clinic to be a standard in the ethical practice of psychedelic medicine. Joining me today is Dr. Manoj Doss. Welcome, Dr. Doss, to the Quick Trip.
Thank you. Thanks for having me.
Thank you for being here. We really appreciate you sharing your wisdom with the community. I want to jump right in. You are a co-founder of the Institute for Integrative Medicine, Minnesota's first psychedelic medicine clinic. What led you to found IIT?
Yeah, well, first, thanks for having me on. It was a very circuitous path. I don't think there is a direct path into psychedelic medicine right now. But my first, I guess, exposure was through Michael Pollan's book, How to Change Your Mind, as it is for many practitioners. And my first thoughts were this was completely preposterous. And I thought this was, hippie medicine and didn't really connect with it at the beginning. Although in college, I, listened to Fish. I went to Widespread Panic concerts. I'd been in the subculture before. The thing that kind of got me going after it was actually reading the literature about it and listening to some of the experts talk, like Robin Carhart-Harris. I'm not a behavioral health provider. My field of medicine is more in the primary care preventative medicine realm, but I appreciate the neuropsychopharmacology aspects of the psychedelics. But most importantly, I look at things at a broader perspective. I have a public health background. I'm an urban planner by training as well. And the one thing that you see from the data is that within the top 10 causes of death in America, suicide is in the top 10. But more importantly, it's one of 3 in the top 10 that's actually increasing. And we just haven't had great tools with psychiatric medications and therapies over the last 30 years. In fact, I see it as the role of healthcare and the role of the mental health system is to meet the demands of its population. And we have not done that over the last 30 years. So we're desperate need of new tools. And I always tell people that, I didn't get into psychedelic medicine because of my past. My past informs me, and I really think that it's important for practitioners in this field to understand the tools that they're using, especially with something so powerful as psychedelics. So one of my goals going into it is to start an ethical clinic that could provide these treatments in a safe environment and provided by someone like myself that actually understands the importance and how to truly utilize these medicines.
Wow, that is amazing. It's so inspiring to hear about ethics really being at the core of the work that you're doing at IIT. I wonder if you could tell us a little more about what makes the care at IIT different, stand out, and what makes it so impactful for clients.
Yeah, well, like I said, I have a background in public health. I'm actually on a citizen committee for the city of St. Paul and Ramsey County here to help advise the mayor and the board of commissioners on public health matters. I take that role important, and I look at things from a very broad perspective, and that perspective in public health is called the biopsychosocial perspective. What we do is a little bit different here, and I call it the biopsychospiritual perspective, where bio is the me and the ketamine, psycho is the psychological support integration that the patients go with their therapist. And then spiritual is the transpersonal journey that the patients will go on. So when we talk about the biologic part of it, ketamine has some really tremendous effects on the brain. Neuroplasticity is a word that gets thrown out a lot, and it's literally the brain's ability to make new connections and create new circuits in the brain. And that's really important for two reasons, because psychedelics is a medication that just now has been shown to create these neuroplastic effects. Before, we didn't really see it other than what the drug called rapamycin. But the spiritual part is important too, because what we've seen in a lot of these psychedelic studies, and this has been shown in some of the work by Elias Dakwar, is that it didn't matter how much ketamine was given. It didn't matter if the patient had a dissociative event. It didn't matter if they had a near-death experience. The thing that correlated the highest with having a global improvement in their symptoms was whether or not they had a mystical experience. And I think that's really important, because it means that there's a therapeutic benefit just in the consciousness expanding experience. It has nothing to do with the biologic, nothing to do with the psychologic. And that in itself, we can treat people with this. It's okay if we don't quite understand what's going on. We don't understand a lot of the interactions of the drugs that we give people. We still don't even really know how Tylenol works for treating pain. But I think it's important to utilize. And I think all three components are really important. So I really see this as treating the patient on three different levels: biologically, psychologically, and spiritually. And I think that's the value add that we give patients, because we do see people holistically, and we can treat people holistically with this medicine, which we really haven't been able to do with other types of psychiatric medications.
That is so exciting. I really love the holistic framework and getting to bring in all aspects of someone's care into the work that you all do. It makes me think about the broader shifts that mainstream medicine is trying to make to adjust to the power and potential of these new medicines of psychedelics. As someone working in this field as a medical professional, I wonder if you could share a bit more about what some of the fixed ideas of mainstream medicine are that have created blind spots in really being able to harness the power of psychedelics.
Yeah, so Elias Dakwar at Columbia has talked about this as well, but there are a few things that I think that are really important that are kind of being dismissed a little bit, and that's one is the privileging the commercialization of these drugs by the pharmaceutical companies, and dismissing not already states of consciousness. There's psychedelic companies now that are trying to create psychedelic medications that don't have a psychedelic experience. And like I said before, the spiritual part of this therapy is one of the therapeutic benefits, and that medicine is almost like a mediator only. So to take that out of the process altogether, I think we're creating a huge disservice to our patients. There's overlooking of the set and setting protocols that all the studies have been using, and then also the overlooking of the psychological mechanisms interplayed too, and all these things matter. Set and setting is integral to the work that we do. And I had a patient earlier today that was talking about the use of ketamine and how he'd never done it in a club scene before, and someone asked him after he did a CAP session whether or not he would entertain doing it recreationally, and he said absolutely not. And that's because the set and setting matter for therapeutic healing, and he recognizes it, and all my patients recognize that as being a fundamental to this process. And I think we have a way of fetishizing the biological aspects. We have all these pretty imagings with functional MRIs, and I think that's extremely important, and we need to know what these medicines are doing in the brain But we also have to recognize that these things like fMRIs, they're indirect measurements. They're just directly looking at blood flow and oxygen consumption in the brain, but it doesn't directly tell us what's happening in the brain. And it's okay if we don't completely understand it. When we look at more of the clinical research data, and when we see things epidemiologically too, we can start seeing that these things do have effect on the population, and we'll learn more on who they're having effect with and why they're having effect with. Like I said before, Tylenol, we don't really understand how that works. Lithium, we don't really understand how that works either. There's a lot of drugs we don't actually know how they work. We just know they work on some given level. And I think, when we look at these drugs going forward, it's going to be that way. Um, and it kind of goes to like just a more, 10,000 foot level, looking at things, the brain model and the mind model. The brain model is, there's going to be, glutamatergic disturbances and synaptic pruning, and there's going to be functional connectivity irregularities, and then obviously the, hyperactive default mode network is what, we talk about in neuroscience. And the contralateral part of that is going to be the mind type model for it. And I hope this doesn't get dismissed at all, because it's, the agitated mind. The agitated mind is, a terminology used in things like Ayurvedic medicine and Buddhist practices. And basically, this agitated state of mind creates suffering, and then that gets in the way of contentment. And in my practice, I don't like to look at things in silos. I like to see things that we can learn things from different approaches to health and medicine. And that includes, cultures that have typically used psychoactive medications. So for spiritual healing. So I think we can glean stuff from that as well. And that in our approach, like I said, we treat the spiritual component as one part of the therapeutic process, that, we're really looking at this therapy as sort of the perfect bridge between these two worlds. I think that maybe the current medicine and the Western practices, that we sometimes dismiss it as woo-woo, when in fact they kind of lean on each other a little bit. We just don't look at it that way. And Ayurveda medicine, there's the three doshas, and if you read a little bit about it, they all have a physiologic, mental, and emotional component to all three. And that really interplays perfectly with psychedelic medicine. So I think we should, not dismiss it, maybe just learn a little bit about it and incorporate a little bit of it.
I really appreciate that highlighting of, these are complementary ideas and ways that we can really have different pedagogies inform one another. It's exciting to me that we are going to have an opportunity as these medicines move more into accessibility in the mainstream. We'll have an opportunity to actually explore those things more tangibly with some tools that aren't available right now. So I know the phase 3 trials for MDMA are underway. They are currently happening. And there is a post-approval landscape that is emerging. So I would love to ask, how are you and the IIT team preparing for the post-approval landscape of MDMA therapy? What will that look like for you?
Yeah, absolutely. And, we're probably not unlike many other CAP companies out there. And, what we do is pure ketamine assisted psychotherapy. We're going to be adding additional services that complement psychedelic medicine, things like somatic therapy and acupuncture, because we think there probably be some synergy there. But just looking at psychedelics in particular, we're creating the infrastructure for any psychedelic assisted therapy right now. I think we have a good model where, I'm the physician, I treat the body. I'm the one that does the medical evaluations, does clearance. I administered the medication. I do all the clearance exams before people can leave. And then, we have a team of therapists that work with me in the clinic, and they're the ones that are the guides. And all of my therapists, I talk to MAPS team quite often. I probably bug them with emails more than most people, but I'm really want to stay up on date on what we can do to prepare best when on day one, essentially. Day one, we can be an operative. And I think they've responded well because we have every therapist that applies to be in the training program from IIT gets in. So I think they understand that what we're doing is a good blueprint for what this therapy might look like in the future. And, you know, other than building the infrastructure with the therapist, me, and the set and setting, we take a lot of emphasis in building our set and setting. I wish I could show you our treatment rooms. There's a big emphasis on the artwork in the room. There's a lot of natural wood in the artwork. Some of it has a Native American motif. We don't try to appropriate any cultures, but we do want to pay homage to the cultures that have used psychoactive medicines for spiritual healing. And then the natural wood, and then we have natural plants, real plants, and trees in the treatment rooms. And that's to emphasize connection with the natural world. And the tree in the room is a banyan tree. And so in Theravada Buddhism, it's the tree under which Buddha found enlightenment. It's also the tree under which the first Jain found spiritual enlightenment. So two world religions, it's connected with enlightenment. We don't have any religious overtones or dogma to the work we do, but we do appreciate the symbolism. And the music, you know, the music we have, we choose music particularly for this experience. We really have fine-tuned sort of our approach when it comes to music, and we read a lot of literature that's come up about how important music is, and I do consider music one of the guides. So it's a little bit different approach than what the psychedelic research clinics have done thus far, but I think that, you know, what we're doing will be kind of groundbreaking. And we also do something a little bit different, and we hope other things will catch on, and that's that we speak to the patient through a microphone, through their headset, and we don't have to take it off to talk to them or check in on them or give them affirmations. Like, we're able to communicate directly with them, which keeps them immersed into the process. So we're hoping other people will adopt that. And then the one other part of IIT that, you know, I'm trying to build up, and I think is going to be important for a lot of these companies that get into psychedelic medicine, and that's to help increase the data that's available for research and be part of clinical trials if possible. So, you know, we're trying to build up that infrastructure to do research. We're in the process of trying to become a clinical trial site for some of the research going on right now, and then eventually do our own primary research through the institute, because I really think it's important, especially to you know, build cachet and credibility in this field, is that, you know, that we contribute to the academic component of it as well.
That is really exciting. And it sounds like IIT already has some incredible processes that are serving your CAP clients currently that will prepare you well for this post-approval landscape, when I believe a lot of things will become more open and change and allow a lot more people to access the healing that they need. I would love to get to ask you, building on that, you know, if you had a magic wand and could make an idea or a change really part of the fabric of the field, I wonder what you would choose.
Yeah. So the thing that comes to mind. So one of the things that I didn't say earlier about my approach into psychedelic medicine is that, you know, after I'd read Michael Pollan's book and, you know, learned more about psychedelic medicine and its use in behavioral health, one of my friends that I trained with, she actually ended up taking her own life, and she was really close to my wife too, and so it really devastated our family. And then after that, you know, I tried to seek answers on, you know, what can we do to change this? And I went to a professional conference, and there were 3 sessions on physician burnout, depression, and suicide. 3 of them in one conference, which is, it's kind of unheard of. And in each one of them, during the Q&A session, there was always someone that stood up and asked a question or made a comment that, you know, burnout didn't start 10 years into my practice. Burnout started in my first year of training. And that really says a lot. You know, the first year of training is when the depression kicks on, and it just never seems to go away. So, you know, I didn't want to answer this question with the 10,000 foot level question, because really my goal professionally, long-term goal professionally would be to one, do some research. Short-term would be to do some research using things like MDMA and psilocybin on residents and healthcare practitioners early on in their career, and do a study on that to see if we can find ways to help people find self-compassion or regain self-compassion and dismiss the ideas that they have now, the fraud syndrome. So my long-term goal would be to maybe start a program where MDMA therapy at the end of every training year is done. As I think in the end that's going to end up saving lives. We've had 2 physicians just in the last 6 months in Minnesota and the Twin Cities take their lives. So it's a topic that's near and dear to my heart, and I think that these medications can do a long way of saving some lives.
Wow, I'm so sorry for those losses. This is very critical, life-saving work, and I really appreciate the perspective you're offering. That the mission isn't just for clients who walk through the door; it's about people providing care, whether they're in psychedelics or not. There is healing that everyone needs to humanize these systems and allow all of us to thrive. That sounds like a really powerful long-term project. Thank you for wanting to do that.
Yeah, we need to heal the healers too.
Mm-hmm. Definitely. That is so powerful. Well, I am really grateful that you've taken this time to share your insights with us. I think my very last wrap up, I want to show the website in case folks want to learn more and just ask, what is the best way for people to get in touch with you and your team at IIT?
Yeah, so our contact information is there. There's a online form that you can fill out if you have questions or comments or want to learn more. We get back to people very quickly, and you can talk to me or one of my partners almost within 48 hours, and we'll be glad to tell you everything we do, the entire process. We tailor everything to the patient. It's not a prescribed formula. If you need 10 prep sessions before you go into the active medicine, we give it to you. If you only need 1, we give it to you. It depends on the person. So we give you what you need, and we have a variety of therapists that focus in different niches as well. We have someone that focuses on LGBTQ, someone that focuses on religious trauma. Everybody's sort of one person in end of life anxiety. So there's different people that can really connect with you on whatever you're dealing with in life. Something we do differently is we also do group sessions that can make things a little bit more accessible for people too. So if you want to learn more in that, we'll be glad to put you in touch with the person that does those sessions.
Wow, that is really exciting to learn about the range of expertise that you all host. Thank you for offering this healing, and thank you for spending the day with us.
Thank you so much, Jen, for this opportunity.
Have a good one.
Take care.
Welcome to our interview series from the Psychedelic Support Network. Psychedelic Support is the leading directory of licensed mental health practitioners and community groups who provide mental health services related to psychedelic medicine and integration, both online and in person. Learn more at psychedelic.support. Dr. Manoj Doss is the founder and medical director of the Institute for Integrative Therapies, or IIT, the first psychedelic medicine clinic in Minnesota. IIT applies a bio-psycho-spiritual approach to care in order to produce small, incremental changes in how patients think, react, and behave, which ultimately leads to living a more purposeful and content life. Dr. Doss is a board-certified physician whose passion in psychedelic medicine stems from a recognition that many of his patients were suffering from depression, anxiety, and trauma, but were not realizing significant benefits from current treatment options. As this field grows, Dr. Doss wants the IIT clinic to be a standard in the ethical practice of psychedelic medicine.